So, Anne, if I'm a public safety officer, firefighter, EMT, police officer, whatever, and something has happened, and I know it's affecting me, but I don't really know if I'm ready to pick up the phone and call a professional. How do I know when the right time is?
Okay. Well, I tell people a lot of things are therapeutic, not just therapy, right? So exercise pretty much trumps everything, medications and therapy. So pump up your workout if you're working out. If you're not, it's a good chance to get some cardio skills on, get some running on. Spend a little extra time with friends and family. If your department has a peer support team, reach out to somebody like that. Reach out to somebody on the peer support team. If there are things that usually make you feel better, do a little extra of those. If you usually feel better when you go fishing, if you usually feel better when you take your kids to the sporting events, then do those things. If things get worse, or if what usually makes you feel better doesn't work, that's time to reach out and ask for a professional.
That makes sense. That makes sense, except you just told me to get out in the world. And I really don't want to be in the world. What's happening to me is I want to withdraw from the world.
Right.
How do I make that happen when that's not what I want to do?
Yeah, that is, isolation is actually torture. Right? So when firefighters get in a situation and they started to, things started circulating and things started going wrong, and they tend to withdraw, they tend to isolate, that's when things get worse, actually. If you think of what we do to the baddest of the bad in prison, it's solitary confinement. Right? So isolation is going to make it worse. And that is a struggle, is to get out and be with people and be with the peer support team and your friends and family.
So even though I don't feel like doing that, do it.
Yep.
And if that doesn't work, then it may be time to think of something.
Then it might be time. Yeah, you might want to call the chaplain on your team, on your fire department. Or you might want to reach out and ask for a professional.
Okay. When I think of professionals, I see all these shingles out there.
Right.
I see MSWs, Master Social Work. I see psychiatrists. I see psychologists. I see all kinds of things. I'm not quite sure what the difference is, but first, what's the difference between counseling and therapy? Two common terms I hear.
Okay, sure. So,
or are they the same thing?
So the term therapy can apply to any different thing. It could be occupational therapy. It could be physical therapy. In this case, psychotherapy is psyche, the care of the soul, right? So psychotherapy, shortened for therapy, and counseling, I use those interchangeably.
Okay, and they're used interchangeably in the profession?
Yes.
Okay. So what is the difference in all the different kinds of counselors and therapists that I see out there? Everything from social workers to psychiatrists, psychologists. What's the difference along that spectrum?
Right. So all of the professionals that you just mentioned have bachelor's degrees, 4-year degrees. Okay. Social workers have 2 years of additional training. Sometimes that's focused in case management, finding legal help and in housing and such. And oftentimes they can do therapy as well. Okay, psychologists, we're doctors. We have a doctorate degree. You might see a PhD behind our name or a PsyD, PSYD behind our name. We're doctors, but we're not physicians. Okay, so psychiatrists are medical doctors. They're MDs. They're physicians. They have special training in the psychiatric illnesses, right? So like schizophrenia, anxiety, depression, and they use medications to treat those illnesses. An oncologist is a medical doctor and specializes in cancer.
Right, so it's like, okay. Is one of those types of counselors more appropriate for certain kinds of problems? And how would I know, in any case, if I just knew there was something that I wasn't comfortable with about myself?
Right.
Or do I just start?
Okay, so a couple things. One, the studies have shown is that what's successful, when therapy is successful, it is about the relationship. It's about the connection. It is about the fit,
Okay.
Okay? So if you know that your particular difficulty is work-related, then you want to choose somebody that specializes in police and public safety, right? So someone who has a 2-year degree might be just as helpful as somebody who has, 8 years of training like myself, if we specialize in police and public safety. Or if you know right now that medication is something that you want to try, right? You might want to start out with a psychiatrist and say, okay, I can't get out of bed. My depression is so severe. I want to try an antidepressant first, and then we'll try talk therapy. So you might start there. Okay. You might say, my difficulty is with God, right? My difficulty is a spiritual struggle. Then you might want to seek out a chaplain, for example.
Okay. I think there's this perception among people not in the profession that somebody with an MSW is sort of a low-level practitioner, and somebody with an MD is this high-level practitioner. And I mean, is that really true, or is it really more just about their experience and their expertise and the connection?
Okay. Well, certainly if you have, 8 years of education, you have a wider knowledge base than somebody who has 2 years after their bachelor's degree, right? That being said, if someone has a 2-year degree after, like a social worker, they may have, 15 odd years of experience with police and public safety, and a new psychologist starting out doesn't, for example.
Okay.
Right? And the other thing is we do different things, right? A psychiatrist specializes in medication, right?
Okay.
Just because a person is a psychologist doesn't necessarily mean they specialize in therapy, for example.
I know that I'm not feeling right.
Yeah.
I mean, I've recognized the point. I've gotten to the point where I recognize I'm too irritable, I'm drinking too much, I'm snapping at my family who I love.
Sure.
I'm distracted, whatever. Where do I need to get to where you would recommend that I pick up the phone and call somebody?
Okay.
What are the telltale signs that now's the time to pick up the phone?
Okay. Well, in one case, the case you just mentioned, someone might be suggesting that it is time to get professional help.
Okay.
Right?
Yeah.
So, so you might think, okay, this person I care about and I love has my best interest at heart. They're saying I should get some help. Then pick up the phone. On a more serious note, I am really humbled oftentimes by how long people suffer before they pick up the 500-pound phone and give me a call. I am humbled to imagine somebody who has not slept well, who is on the verge of divorce, who has been, upset and irritable and lashing out. No matter what they did, it didn't matter, feeling hopeless for 2 years. All of that wasn't as bad as walking in my office. I think people suffer too long.
It's awfully hard for those of us in public safety to think we need help, because we are, we're the superheroes of society, really.
Right.
And we like to, we often think of ourselves that way.
Yes.
How do you get over that hurdle? What have you seen in your career make people with that kind of outlook finally realize I need to go see somebody like you?
Well, what they're doing just doesn't work anymore. Or maybe they realize, hey, we're all human. We're all human. I don't know how to get out of this box because the directions on how to get out of it are written on the outside, and other people are noticing this. Sometimes it's something really, really bad or really awful that happens in their personal life or in their professional life, where the straw broke, or there's just too many trucks parked in the garage, or there's too many rocks in the backpack, or what have you.
Gotcha. Okay. So let's quickly address the issue of confidentiality.
Right.
Because that's what keeps a lot of people that think that maybe there might be somebody out there smarter about what's going on with me than me, from actually picking up the phone. So if I pick up the phone, if I'm seeing you, if I'm seeing any one of these other kinds of professionals that we just talked about, tell me about confidentiality. What must they disclose? When must they disclose it? And what can't they disclose?
Okay. So first of all, we don't want to disclose things, right? Our license is on the line.
Okay.
Okay. If a provider like myself breaks confidentiality, we could lose our license. We could lose our career, right?
Okay,
That's a serious thing for us. There's really no motivation for us to do this.
Okay.
Okay. Confidentiality is a legal concept, right? It's illegal. It's a law in states. Okay. In California, we're mandated reporters, just like the first responders I work with. If you tell me that a child is being abused, if you tell me that an elderly person is being abused, someone is stealing grandma's Social Security check, we're mandated reporters for those types of things. If someone tells me they are going to kill this person at such and such a time, we have a duty to warn that person. We have a duty to warn, we have a duty to break confidentiality in that situation. If a person is thinking about suicidal thoughts or thinking about killing themselves or hurting themselves, that's not reportable.
Okay.
A plan, somebody who has the means, somebody who is going to do that, then I might break confidentiality in that situation. I might call their emergency contact person, right? You listed this person with this phone number as an emergency contact. Let's call that person and see if they can stay with you tonight. That might be a breach of confidentiality in that situation.
It sounds like what you're saying is if a specific person is, if you have reason to believe that a specific person is definitely in danger with information that I'm giving you, that is the key.
Well, the future is the key, right?
Okay.
So if someone if somebody tells me they have hurt someone, that's that's not reportable unless it's a child or an elderly person, right?
Yeah.
So if they say I am going to harm this person, that's reportable.
What about general kind of thoughts about violence or wanting to lash out in general? Is that going to cause you to call, to tell somebody, to tell on me?
Ralph, oftentimes lashing out at people is what landed the person in my office in the first place, right? So they're having difficulties because they've been lashing out, right? And so if we talk in my office about how things are just at the breaking point and they are yelling at everybody and they are irritable and they are cranky and not their normal self, let's talk about that. If things are so bad that the person in my office is thinking about killing themselves, if things are that bad, let's talk about that. Let's talk about those thoughts. Let's talk about those ideas and the reasons for all that.
What I hear you saying is that if I'm going to hurt somebody, then you are mandated to keep that person safe. But if
or warn that person.
But if I am telling you that I'm having thoughts or fantasies about hurting people, that is not something you really need to do. You need to break confidentiality.
Right. Everybody feels like they're going to lose their temper. And if this kid does this thing one more time, they're just going to lose it. That's the focus of therapy. That's what we're going to talk about.
And it stays with you.
Yeah.
Okay. Same with suicidal thoughts? If I'm saying I'm feeling like it's not worth going on, that stays with you?
Yeah, nothing I do is working. I'm feeling so hopeless. It doesn't matter what I do, nothing seems to be working. It doesn't matter how hard I try, things are not going to get better for me. That is the focus of therapy.
Okay, so that's the purpose of being there.
That's the purpose of being there.
Gotcha.
Yeah.
Okay. So I've gotten over the notion that I might need to talk to someone who's an expert in these kinds of things. How do I go about it? There's so many people out there. Right. Do I just pick up the phone and dial randomly, or how do I find the right person for me?
Good question. Okay, so A couple places to start. One is the website Psychology Today has a good find a therapist function.
Okay.
And you can search by insurance coverage, by zip code, by gender, by problem type. You might click off the box that says post-traumatic stress or divorce or ADHD, whatever your problem is. You can search by language. They have a great search function. So you might start there. If you have insurance, your insurance might have a list of providers that they will pay for. Okay? So those are some places to start. You might also ask a friend or a family member or a coworker. Sometimes providers have reputations with departments.
So I've narrowed it down to a few people that I think might be helpful. I need to pick one to start with. How do I do that? What questions do I ask when I call?
Okay, so you might ask about experience with police and public safety. Okay, have you treated post-traumatic stress? Are you familiar with the culture of the fire service? Okay, have you done this before, basically? You might ask about how long they've been in business. You want to make sure that they're licensed. Anybody who's on an insurance panel should typically be licensed in their state.
So I found somebody with experience. I found somebody that has some understanding of my job or has worked with public safety professionals before. That seems like they might be a good fit. Do I need to worry about what their approach is? I mean, is that my job, or is that the therapist's job to figure out whether their approach, the approaches they're trained in and comfortable with, work for me?
Okay, well, a couple different things. One, let's say you're wildland fire. Okay, and so it's spring, and maybe you want to, talk about a couple things before the fire season starts, so you can enjoy, fire season as much as possible, right? So you might want to say, I'm looking for some brief therapy. I'm looking for some short-term therapy. You might be in a situation where an elderly parent is dying. Okay, this is a horrible situation, but it's time limited, right? This is grief. You're dealing with a grief issue. And so you might want somebody with that type of experience and that type of focus for that type of problem.
So you're saying therapy doesn't have to be long-term. It can be time limited. It can be short time limited.
It sure can. It sure can. Yep.
Okay.
Sometimes it's 1 or 2 sessions. For example, sometimes a session can be just literally reminding the person of, well, what used to help, right? What did you do the last time you had this problem? And just reorienting them and reminding them of what they used to do that helped. Another situation, it may be that in one session you realize this is actually a medical problem. This isn't psychological, this is a medical problem. It looks like a psychological problem, but you need to see your medical doctor.
Okay. Would the same thing be true if I came to you and you were a practitioner, you had a certain approach, you had certain techniques that you were trained in and were comfortable with? Would you recognize that those might not be the right techniques or approach and refer me out to someone that was more appropriate for me?
Yes, and the reverse also might be true, right? The firefighter might say, this isn't working, I need to find somebody else. Do you know anybody else who does this, right? Or like in an example you just gave, I don't treat eating disorders, right? Or if somebody gives me a call and says, I have postpartum depression, I don't do that. That's not my type of work.
So if we're working together, I've had 1 or 2 sessions with you, and I mean, obviously, no practitioner in any field knows everything. So you've got certain approaches, you like certain techniques that you're trained in. Whose job is it to recognize that those techniques or that approach may or may not be the best approach or technique for me? Is that your job or my job?
I think it's mutual.
Okay.
I think it's mutual. Certainly, if you're the firefighter sitting with a therapist and you feel like you're doing all the talking, right? Or you're not getting anywhere, you can certainly ask for some specific suggestions. Or you can certainly speak up and say, I don't think this is going anywhere, right? The therapist might say, so last time when we met, we talked about this, and this time let's look at it at a different angle.
Okay. One of the banes of MDs, primary care physicians all across the country, is their patients come into their office and say, "I've been searching on the internet, and I know I need a prescription for X," and it just drives doctors crazy. They go, "Oh, wait a minute, let's talk about."
Right.
Okay. So,
right.
do people come in to you? How useful is it for someone to call you and say, "I think I need X, cognitive behavioral therapy, or EMDR, or whatever therapy that they've been reading about"? Is that useful or not?
So yeah, sometimes that does happen,
Okay.
and sometimes it is useful. In the case of cognitive behavioral therapy, a lot of people know that term, right? And it's popular, or people have heard of that, or that makes sense, so they might be asking for that. Cognitive behavioral therapy is looking at your thoughts and what you're actually doing. If you're working out, if you're taking your dog for the walk, what is your behavior if you're yelling and screaming? And then your thoughts, what you're thinking about the problem, how that's influencing your mood. So if you know that that's helpful, you can ask for that. But again, it really is about the fit.
Okay. So I keep hearing you saying it's about the fit. And so I guess to wrap up this line of questioning, let me summarize it for you and see if you agree.
Sure.
It's really important to find someone that you're comfortable with, that seems to understand you,
Yes.
your job, what you've been through.
Yeah.
And if the approach that professional is taking doesn't seem to be fruitful, it's really their job to let you know that and to recommend something else. Is that true? Okay, good.
And if you have that sense that this isn't working, that this is not helpful, I'm not feeling any different, I'm not feeling any better, it doesn't mean that therapy's not helpful. It may mean that a different professional is better for you, is a better fit.
Okay. So what is therapy like? I mean, this is a big fear for people who've never been through it. What is it like?
It's a conversation. It's a relationship. It's a very unique relationship where you get a different type of attention than you do in any other situation. But we talk. We talk about problems. We talk about what's going on in a person's life.
It's a conversation.
It's not magic. It's not voodoo. It's not New Age.
You're not doing anything physical, like
No,
rewiring?
we're not rewiring the brain.
Okay.
No.
Okay, it's just talk. So what's the first session like with a new client?
Well, typically there's paperwork.
Okay, yeah.
Sometimes people want to start out with what's going on with them right now. They might say, okay, here's the situation. My ex-wife and I are having a lot of problems. Our son is not doing well in school, and I'm not sleeping well, and I'm lashing out at my coworkers. This just isn't like me. So they might talk about what's working or what's wrong, what the problem is right now in the present. They may also start with something from the past. They might say, okay, I went on a SIDS call this time and it was horrible. It was a horrible situation, and I don't understand why this particular SIDS call was so awful when I was on 3 in the last 6 years, and I seem to recover. I seem to get over those or get through those. So a person might start with the situation from the past. The other option is that a therapist might start asking the questions. They might have some starters. I also think that a great line for a new client is, so where do we start?
Okay. Who's in control in therapy? I mean, one of the big fears of people in public safety is that we have invested a great deal of emotional energy in maintaining control.
Yeah.
Both of the situation out there and
Right.
what our reaction to it. So who's in control?
Right. It isn't about that. It's not about control at all. It's not. No one's going to force you to say something that you don't want to say. You can leave at any time. The door's not locked behind you. It isn't about control. It's about a relationship, right? It's about two people talking about what's going on with you at this present time.
So we talk in therapy. What good does talking do? I can talk to my buddy. What good does talking do?
Yeah, it's amazing. It really is amazing. I wonder that too. Like, how does this help? It's just, it seems miraculous and amazing to me too. But yes, it does help. Some people will say it's like a weight has been lifted off their shoulder. They just finally need to get this one thing out. And when they finally told another person this, they feel some relief. They do feel better.
I can see why talking would help. I mean, I think that's kind of obvious when people think about it, but why is it so important in some cases to talk to a professional?
Okay, so we obviously have some skills and some education. This is what we do for a living, right? Sometimes it takes that outside person. Let's say, for example, you've been having this thought about this call that went horrible, several years ago, and it's been running around in your head, woulda, coulda, shoulda, woulda, coulda, shoulda. When you go to a professional and they say, okay, let me ask you this. If that same injury accident were to happen in the parking lot of an emergency room, would that patient have survived? And the firefighter can kind of think about it and say, well, no, the injuries were not life-sustaining. They were too catastrophic. Sometimes it is that question, or questions like that really make the difference, and that's the turning point for that firefighter.
So, if I understand you, what you're saying is that because you do this all the time, and because of your education and experience in this, you know what questions to ask and how to gently guide the client's thought process, whereas some random person off the street probably doesn't.
Not necessarily, no. Some random person doesn't always know. And there may be things that you don't want to share with your neighbor. There may be things in your life that are too private and too personal to share with somebody that you work with. It may be too private.
Which brings us, of course, right back to confidentiality.
Right.
And I know you have a serious side, but I see you laughing a lot. And it sort of runs counter to my notion of what therapy might be like, because to the uninitiated, we tend to think of therapy as sort of this dark, heavy process. Is it a light process? Do you laugh as much in your sessions as you are doing with me now?
Well, okay, a couple things. Yes, we are going to get to the hard stuff. Yes, we are going to talk about some really difficult calls, some really painful things. But at least in my business, police and public safety officers have a pretty, dark sense of humor. And amongst the general public, I think sarcasm is a lost art, right? And, the police and public safety psychologists that I know, we have just a warped sense of a humor as our clients do. So yeah, we do laugh. We do laugh.
So it's not a comedy session, but it's not dark and heavy either.
No, it's not as dark and heavy sometimes as people think. We're gonna have to talk about that painful stuff too. And again, it's a relationship, right? There are funny things that happen at work. There are funny things that happen in the session. There are funny things that happen in life. Yeah, we have to talk about the bad stuff, but the funny stuff is part of it too, I think.
So Ann, I've taken the leap. I've called you. I've come to meet you. We have our first session together. What am I going to walk away with after that first session?
Well, I'd love to promise you a cure. But what I can tell you is that some of my clients have said, what a weight has been lifted. Well, I just feel so relieved that one person has finally heard this. This has been weighing on my mind. It's going around and around, and I'm just glad that one person, I'm just glad I got it out there. I'm just glad I, said it. Sometimes people will say, well, that wasn't so bad.
Yeah.
I think I'll go back. I'm not sure why. Some people are completely new to therapy. So they're sort of left with a curiosity about it. Okay. Not sure what happened there, but it wasn't as bad as I thought it would be. The main thing I think in the first session is for the client to decide, is this the right fit? Is this a good person? Do you think that you could build a relationship with this person and talk about some difficult material? Or in the first session, did the professional have you up here, as you're some superhero and, you have all these fabulous, gory stories? Then you're not in the right therapy, right?
Got it. How long, this is probably a difficult question to answer, but
Sure.
How long can I expect to be in therapy for if I have, I don't know, a typical problem? Is there such a thing as a typical problem? How long can I expect? How long can I expect this to go on for?
As long as you like, as long as this is helping you, as long as you're finding it beneficial in some ways, as long as insurance covers it, as long as you need to. It doesn't mean that it's forever. It doesn't mean that it's forever.
But chances are I'm probably signing up, if the therapist and I are the right match for each other, chances are I'm probably signing up for a couple months anyway, huh?
I guess it would depend. Let's say, for example, you have an elderly parent that is dying. Okay? As awful as that is, that's a short-term problem, right? I mean, if they're at the end stages of some awful disease, you might make some appointments just to sort of, remember some coping mechanisms and just be reminded that this is awful. Many people experience it. There are some support groups, just some general support. Just some basic help around that problem. And then maybe that grief has subsided and you're feeling better, then maybe you're done. Other times, a first responder will come in with, like we say, multiple rocks in the backpack. They've been walking around doing this job for years and years, and they've been collecting rocks in their backpack. And they come in and they've got quite the load. And then it might take a little bit longer. Then it might take a couple months, like you said. And for the first meeting, I have some goals. There are some things I'm trying to learn. I want to know a little bit about what the client is coming in with. What's troubling them now? If I'm meeting with a couple, the very first question I ask is, what's going well? What's going well? And they're not expecting that, right?
Right, yeah.
When I'm working with a first responder, I'm also looking for what is the strength that has gotten them through previous difficulties. What do they have going for them? Where is their resilience? And how can I apply those skills, that resilience, and that strength to what they're dealing with right now? Those are some of the things that are going through my mind in the first session. How long has the problem been going on? How serious are the symptoms? What other things have they tried? Do they have a peer support team? I'm always asking about that. Do you have a peer support team in your department? If you have, if you do, have you talked with them? I'm always wanting to know what they have already tried before they sit down with me.
Once I call you, once a new client calls you and wants to meet, are they committing at that point to a long-term relationship, or is there sort of a getting to know period? Is there sort of an initial consultation where you both figure out whether it's going to work or not?
Well, I guess in general in life, you get out of it what you put into it, right? I mean, that's true for a lot of things. So in the very beginning, it's a big day when you first come to therapy. It can be a big day. It can be, something that you've been sort of waiting for, and finally, you can start. Finally, you're going to make some changes in your life, and this is the beginning of a change in the way things have been going for you, right? That being said, if you find that this is not the right therapist for you in the very beginning, you certainly don't have to go back, and it's okay to say that.
Will my chief find out that I'm in therapy?
Well, not if you don't post it on Facebook. Right? And I mean, how do you know that your chief is not in therapy down the street with another psychologist at 2:00? Right? I mean, People go to therapy. It happens. The other response I have to that is, why would someone like me, a psychologist, want to tell your agency or anybody else that you're seeing that person in therapy? I could lose my license if I break confidentiality.
Okay.
I could get a steep fine. Why would I want to risk my job and my license and everything I've worked so hard for by telling somebody something like that? Well, and I do know therapists that have a separate indoor and outdoor. So when you walk into the lobby, you don't see the person that's leaving the session before you.
Mm-hmm.
Personally, I schedule appointments a half an hour apart. So I'll have a 1 to 2 o'clock appointment, and then I have a 2:30 to 3:30, because part of my job is to protect confidentiality. Part of my job is to know who's in the parking lot in that half an hour.
Okay. And my understanding as a layman is that there are different classes, different types, different approaches to therapy. You've got something like talk therapy, where you're talking issues through, and probably cognitive behavioral therapy is a term in that class that people might have heard of. You've got techniques that help the brain to become more functional, or to rewire itself in a more functional way. And a lot of people have heard of EMDR as a technique in that class. And then you've got activity therapies, things like art therapy and equine therapy. But you know a fair amount about EMDR. Can you tell us what it is and how it works?
Yeah, sure. So eye movement desensitization and reprocessing, EMDR, is a therapy that was discovered in the late 90s by Francine Shapiro. It is a technique that stimulates the left and the right and the left and the right hemispheres of the brain simultaneously as a person is talking about or imagining a traumatic incident that has happened. And as they are talking or reliving this experience, they become desensitized to that, the punch of that image, or the physical ooh they get when they think about that traumatic event, right? So they're desensitized to that. Their body's desensitized to that. They can become it makes it easier for them to talk about that traumatic event without being upset.
You say it stimulates the left and the right. How do you do that?
So a couple different ways. One, again, it's eye movement. It was discovered by moving the eyes from the left to the right to the left to the right. So sometimes the technique is that a client will follow a light bar where the lights move from the left to the right. Sometimes clients will put earphones on and they will listen to a tone going off on the left and the right and the left and the right. Sometimes people will hold on to pulsers. It feels like a cell phone vibrating in your hand, and that will vibrate from the left to the right to the left to the right. And they talk through their traumatic event, their traumatic incident, and their brain reprocesses it. So it's a complicated way of they have a different view of the situation. So for example, let's say a firefighter gets stuck in a garage and thinks, I'm going to die. I'm going to die here in the garage. This is it. No one's going to find me. My oxygen tank is low. I'm going to die. Well, they didn't die. They're acting and living and believing and feeling in their body as if they're going to die. Reprocessing that memory through EMDR helps their body realize and helps their mind heal to realize, but I'm okay, I'm safe now. And then their anxiety symptoms can be greatly reduced or gone completely.
That sounds almost too simple to be true.
Yes.
But it does work.
Amazing. Amazing.
How do I know when it's time to stop therapy? Who makes that decision anyway?
Well, ideally, it's mutual, right? Ideally, it's the therapy stops not because insurance cuts you off at 5 visits.
Yeah.
Right? Ideally, it's mutual, where sometimes it can be as simple as, look, I started therapy because I was yelling at my kids and I wasn't sleeping. And I'm sleeping now and I'm not yelling at my kids. Life is good.
Yeah.
And, therapy's done. If you take like a symptom approach, right? Sometimes it's pretty obvious because sometimes it can be just as obvious when there's nothing to talk about. Right?
Okay, yeah.
So the client is driving up and saying, I don't know what I'm going to talk about today. Well, we might be done.
Okay. Yeah.
Right? We might be done.
Okay. So either party can sort of come to that conclusion.
Ideally, yes.
Okay.
And the great thing about, or the unique thing about therapy is that when the relationship is when the therapy is over, this is one relationship where you have a unique opportunity to say goodbye.
Okay.
You really do. You really do. And stopping therapy in June doesn't mean that, 2 Octobers from now, you don't come back for a couple visits just to sort of catch up or just for a brief tune-up. So just because you stop therapy because you're feeling better, you have that therapist as a resource.
Okay.
You know that they can be helpful in the future should you want to chat with them later on.
And this is kind of a pointed question.
Okay.
But how do I know that my therapist doesn't have this financial incentive just to keep me coming and coming?
Well, first of all, if you're paying with insurance, the therapist is probably not making a whole lot of money.
Okay.
Okay.
Yeah.
Okay. Second, if you think that money is part of therapy, then talk about that. I think that's a great question, a very poignant question to ask your therapist, right? Personally, for me, I don't want somebody in my office longer than is needed. I don't want to talk about the weather. I have a waiting list. There are other people that are hurting that need my help. If somebody is done with therapy and there's nothing to talk about, I don't want to foster a dependency. I don't want the person to think that they need to come to my office every single week for the rest of their life. I don't want that.
And there is so much reluctance in the public safety profession about psychotherapy. Okay. What would you say to a first responder that could probably benefit from it, that's in a bit of pain, but is very reluctant to pick up the phone and call somebody like you?
What's the worst thing that could happen? What's the worst thing that could happen if you picked up that 500-pound phone and you talked to somebody that might understand what you're going through or might understand how to get through it? What's the worst that could happen? It's maybe not going to, cure everything in 24 hours, but is it going to make it worse to talk about it? Well, let me tell you this. Here's a few things that my clients have said. I wish I would have known you sooner. I wish I would have started this process earlier, or I wish I didn't let things get this bad before I started therapy.